Good morning, ladies and gentlemen. Mr. Chairman, thank you for the forum. I introduced my chat with this slide, which has nothing to do with me, but please note, this slide actually describes me as unemployed, so there is a future for you. I'd like to talk to you about what I believe personally to be the evidence base for anti-aging medicine. And from early days, drinking beer in the Alexis Hotel, which was really the first meeting of A4M, probably more than 2 decades ago, we've come a long way. And we kicked off with the idea that the maintenance of general health would improve longevity. But these days we're looking at some real science that underscores the idea that we may be able to really approach longevity, which is obviously extended life in good health. Now, if I was to choose anything in terms of anti-aging medicine that had a real foundation for the future, it would be calorie restriction, telomere function, and the use of stem cells in some way. Now, I need to stir the pot and tell you that things like bioidentical hormone replacement therapy, while of some intrinsic value, are merely band-aids. The idea of injecting growth hormone is just another band-aid. These are not sustainable anti-aging interventions. So if there are any missiles thrown, don't worry, but the issues are, this is the science of anti-aging medicine, like it or not. So if we look at these things in aggregate, when I wrote my book, The Anti-Aging Triad, which came out recently, I started to think in terms of a trilogy. 3 separate entities that contributed to longevity medicine. But then I realized how interdependent these 3 aspects of anti-aging sciences were. And I shall try and bring that out in this discussion. These are not circumstances that occur in isolation. So with an eye for the future in anti-aging medicine, we have this triad, intimately interrelated group of approaches involving stem cell technologies, calorie restriction or the use of restriction mimetics, and further approaches to prevent the attrition of telomeres or sustain their length. Now, let's talk about calorie restriction and understand that being fat challenges life. I coined a term about 15 years ago when I wrote a book on metabolic syndrome, and the term was obesitis. And we heard from the previous lecturer the importance of the association of obesity with inflammation. But we have a large body of medical evidence that shows us that reduction of calorie intake of the order of 50, perhaps even up to 70% below average free feeding rates inhibits the aging process in all species tested. And we've known this now for approximately 70 years. And to some degree ignored it until recently. So being fat or being obese is a threat to long, healthy life. And if we look at a target reduction of about 40% of average calorie intake on a 2,000 kilocalorie diet, that's where we should be in terms of health promotion, inferred from studies. That said, this is unattainable. We just cannot inflict this type of calorie restriction. So, obviously, if you reduce calories, when we have foods that are dilute in vital nutrients, then we must use nutrient-dense foods. We must use quality food. So that really disqualifies us from supermarket frozen food. And in fact, the person that really made major contributions to these concepts was Roy Walford, a distinguished UCLA scientist who described in a popular book what he called the 120-year diet, where he was using high nutrient density with low calorie intake. And that's the issue. That's the key issue.